All right, good afternoon, Southbridge. Welcome to the Emergency Operations Center Facebook Live brief. It's been a long time since we had one of these, so today we have with us is Chief Woodson to give the update on the EOC. We have Jasmine, who will interpret our words from English to Spanish. We have Harry and Dr. Powers from Harrington Hospital will be giving the majority of the brief to the town residents. I just want to start off by saying, as of today's counts, the town of Southbridge has 1,251, or had 1,251 cases, and again, that's Southbridge residents. There are 1,001 cases that have been closed out of those 1,251. 8 cases that have been reported to Southbridge residents, but by the state, they are not residents of our town. We have 23 deaths, unfortunately, and currently we have 219 cases that are active in the town.
Bienvenidos a todos del pueblo de Southbridge a nuestro Facebook Live de la operación de emergencia del pueblo de Southbridge. Estamos aquí hoy con el concejal David Adams, con el jefe Shane Woodson del cuartel de policía, con el señor Lemieux del hospital de Harrington, y estamos aquí hoy con el doctor Frank Powers, también el jefe de los médicos del hospital de Harrington. Queremos empezar el breve de hoy con las informaciones sobre los casos que tenemos en el pueblo de Southbridge. En total tenemos 1,251 casos de los residentes de Southbridge. De esos casos, 1,001 son casos que han sido cerrados o recuperados. 8 casos que eran reportados de residentes de Southbridge, pero no le pertenecen al pueblo de Southbridge. 23 de los residentes de Southbridge que han fallecido desafortunadamente, y 219 casos activos en el pueblo de Southbridge.
As I mentioned each time, we do have the school meals that are provided. That's 7 days worth of meals that can be picked up at the Charlton Street School, regardless of any learning model, hybrid, remote, or in person. Please contact help@southbridgepublic.org or ayuda@southbridgepublic.org with any questions.
Entonces, como hablamos siempre de las comidas de la escuela, estas comidas las tienen 7 días de la semana y pueden ser recogidas en la escuela de Charlton Street. No importa la manera de aprendizaje, el modelo de aprender, hybrid, remoto o en persona. Por favor, se comuniquen con help@southbridge.org o ayuda@southbridgepublic.org con cualquier pregunta que tengan.
All right, these meals are available to students who are Southbridge residents under the age of 18 years old. You do not have to register in advance to receive the 7-day meal package.
Estas comidas están para cualquier estudiante de Southbridge, del pueblo de Southbridge, el residente que tenga menos de 18 años de edad. Usted no tiene que registrarse anteriormente para recibir estas comidas de 7 días.
And lastly, the town hall, until further notice, town hall the town hall will be closed to the public. Town hall will conduct business via phone, email, Dropbox, and in certain cases, by appointment. Please call the numbers for each department or feel free to email anyone. These numbers and emails are on the town's website at www.ci.southbridge.ma.us.
Y sobre la alcaldía del pueblo, da el noticiero desde ahora, la alcaldía está cerrada para el público en general. La alcaldía va a conducir los negocios a través del teléfono, a través del correo electrónico, a través de la cajita de llevar cosas afuera y en ciertos casos por citas. Usted puede llamar los números para cada departamento o puede comunicarse con ellos a través de correo electrónico. Estos números y correos electrónicos están en el sitio del pueblo www.ci.southbridge.ma.us.
And turn it over to the Emergency Operations Center Incident Commander, Chief Woodson.
Good afternoon and thank you for joining us. Just real quick before we turn it over to the hospital staff, just our last Facebook Live event was in December, just before Christmas. Last Emergency Operations Center meeting was on Monday, the 11th of January. Real quick, just a housekeeping issue. I'll get into it in one moment. It's just December, Jack.
Oh, okay. Bienvenido al evento en vivo de Facebook. El último en vivo fue antes de las celebraciones de Navidad, que eran en noviembre, y nuestra última reunión de la operación de emergencia fue el lunes 11 de enero.
At some point in the very near future, the townwide emergency notification system is going to be available to all citizens. And on that website, you'll be able to receive COVID-19 vaccination updates. We're still working on that, but just stay tuned for more info. We're going to be posting that on the Police Department Facebook page, Fire Department Facebook page, and also on the town website. And we hope to have that done within the next month or so.
En algún punto en el futuro, el sistema de emergencia del pueblo para los ciudadanos van a poder recibir información sobre las vacunas del COVID-19. Tengan alerta para esta información que va a estar en las páginas del Departamento de Policía y las páginas del Departamento de Bomberos y el sitio del pueblo en el Internet.
And today, once again, we're very fortunate to have Harry Lemieux, CIO of Harrington Hospital, in the background, and Dr. Powers, who's seated here today. Both were kind enough to volunteer their time to participate in our live event. I just wanted to thank them for that in advance.
Hoy tenemos la fortuna de nuevo tener a Harry Lemieux del Hospital de Harrington y también hoy tenemos al Dr. Powers que fueron simpáticamente voluntarios para estar de su tiempo con nosotros para participar en el evento en vivo en Facebook y le queremos dar las gracias al doctor.
So if I could turn it over to Dr. Powers.
Sure, thank you, Chief Woodson. Thank you for inviting us here and giving us a chance to give an update on the COVID pandemic, and at least from the perspective of the Harrington healthcare system. So as you've heard, my name is Frank Powers. I'm the Chief Medical Officer for Harrington Healthcare. We are here today to give an overview of the COVID-19 pandemic from the perspective of the healthcare system, which serves the town of Southbridge and the surrounding towns. Overall, right now we're in what would be considered the second surge of the pandemic in the state of Massachusetts, the first surge being in the spring, which peaked in April and declined thereafter. We had a relatively calm summer, and then the pandemic again ramped up in the fall. And right now, what we're seeing is a surge that's more severe, particularly here locally, than it was in the springtime.
Muchas gracias al jefe. El nombre de este señor es Frank Powers. Él es el jefe de los médicos de Harrington Hospital. Entonces, aquí tenemos un reviso de la información sobre el COVID-19. Sobre el reviso, estamos en el pico de nuestra segunda ola. En el verano había estado más calmado con los casos, pero ya hemos visto resurgir los números del COVID-19. Ha sido mucho más severo localmente desde la ola de la primavera.
Okay. Just to give an overview for some of the numbers that we've seen in the United States, there have been almost 25 million cases of COVID, with over 400,000 deaths. And in Massachusetts, there have been about 500,000 cases with nearly 14,000 deaths, with a projection to reach over 17,000 before this particular surge is over by hopefully the springtime.
Entonces, revisar la situación de COVID-19 en los Estados Unidos. Han visto casi 25 millones de casos y más de 400,000 muertes. En el estado de Massachusetts hemos visto 500,000 casos y casi 14,000 muertes.
With regard to testing, Harrington continues to operate 2 drive-through test centers, one in Southbridge and the other on our Webster campus at the old Hubbard Hospital. We also do testing in both emergency departments that we run, as well as in the hospital. We have to date performed over 43,000 tests, with yielding 2,600 positive COVID cases, giving a 6% positive rate since the beginning of the crisis, though for the past week the numbers have been higher, running about 9%.
Entonces, sobre un reviso sobre los exámenes que el hospital de Harrington ha sido durante estos tiempos en los locales aquí en el pueblo de Southbridge y en el pueblo de Webster en el hospital de Hubbard. Harrington ha tenido 43,000 exámenes con 26,000 casos de COVID identificados. En todo, 6% positivo a 9% esta semana pasada.
As far as the hospital goes, it's been very, very busy with both COVID and non-COVID patients. Again, locally, we've seen more COVID cases this winter than we did last spring. We had a record number of COVID patients in the hospital last week, with 24 patients in one day in the hospital, which thankfully is somewhat decreased. We're down to 14 today, and hopefully that trend continues.
Entonces, sobre el hospital, han estado bien ocupados con pacientes de COVID y los otros pacientes también. El hospital ha visto más de 24 pacientes de COVID esta semana pasada y ahora ha bajado ese número a 14 pacientes, afortunadamente.
The question on a lot of people's minds is about the vaccine these days. And right now, for about a month, beginning on December 16th, we've been operating a regional vaccine site at the Southbridge Community Center, which we believe is the first regional vaccine site in Massachusetts. We've set ourselves up to vaccinate the citizens of South Central Worcester County, and since have opened up to across the state to healthcare workers and first responders. To date, we have given over 3,000 vaccines.
Entonces, todas las preguntas sobre las personas que quieren información sobre las vacunas. El hospital tiene un local en el centro de comunidad de Southbridge, que es el primer local regional de Massachusetts. Hemos dado 3,000 vacunas desde que empezamos en diciembre 16. Entonces, el hospital está enfocado en ayudar y vacunar a las personas de esta región del estado.
So far in the United States, the FDA has approved of COVID vaccines from 2 different companies, one from Pfizer and the other from Moderna. These are similar vaccines in that they are both 2-shot series with nearly equivalent efficacy and side effects. The efficacy for both after completion of the 2-shot series is approximately 95%.
Entonces, los Estados Unidos han aprobado 2 tipos de vacuna, una de Pfizer y la otra de Moderna. Entonces, que las dos son muy similares, muy igual. Las dos tienen 2 vacunas que le dan a las personas con 95% protección.
That being said, the state is mostly allocating us the vaccines from Pfizer because we are one of only several sites in the state with an ultra-cold freezer, because this vaccine is required to be stored at -80 degrees Celsius.
Entonces, el Estado ha aprobado, nos ha dado mayormente la vacuna de Pfizer porque somos uno de los únicos locales que tenemos un congelador para poder tener la vacuna en unas temperaturas que son apropiadas.
We are currently capable of vaccinating approximately 200 people per day at the Harrington vaccine site and are in the process of ramping up to be able to do 500 patients per day. The state so far has just allocated us an additional 10,000 doses in the past couple of weeks to ensure the people of the area an adequate supply of testing as we do, of vaccines as we ramp up our capacity.
Ahora, en estos momentos, tenemos la habilidad de vacunar aproximadamente 200 personas y estamos trabajando fuerte para crecer nuestra capacidad a 500 personas pacientes por día.
One of the biggest questions that people ask is when can they get vaccinated? And in Massachusetts, the government has set up a 3-phase system. We are currently in phase 1. This primarily encompasses healthcare workers and first responders, in addition to which we are including long-term care facility workers and patients, home healthcare workers, and residents of group residential facilities, such as group homes and prisons.
Entonces, la pregunta que tiene todo es ¿cuándo se pueden vacunar? En el estado de Massachusetts estamos en la primera etapa, que usted puede ver en mass.gov. Corrientemente, las personas que se están vacunando son los trabajadores de salud, las personas pacientes y trabajadores que trabajan en facilidades de cuidado de término largo y el personal de emergencia.
We are currently still vaccinating healthcare workers and first responders, though have opened up to those workers from across the state.
Corrientemente estamos vacunando al personal que trabaja en los departamentos de salud y personal de emergencia y estamos a plazo para vacunar a más personas.
Phase 2 is expected to begin sometime in the next month, which includes high-risk patients and other critical infrastructure workers. High-risk patients to begin with will include those individuals over 75 years of age and with medical conditions placing them at high risk, such as chronic lung disease, diabetes, and cancer.
Entonces, la etapa 2 puede empezar más o menos en el mes próximo para vacunar a los pacientes con riesgo alto y otros trabajadores críticos, incluyendo las personas que tengan 75 años o más y personas que tienen condiciones críticas como enfermedades en los pulmones,
lung disease, heart disease, cancer, diabetes.
Diabetes y problemas con el corazón. Estos tipos de personas pueden ser vacunadas entre un mes.
The state has a fairly prescriptive order of who should be vaccinated, and should there be any confusion, I would recommend that patients contact their own primary care physicians to give them some guidance as to where they fit in the vaccine timing process. The exact timing of who is going to be vaccinated when is fairly loose right now, again, but it's confined to phase 1. When we open to phase 2, it'll be at the state's discretion, and again, it's anticipated to be sometime in approximately 1 month, following which, by approximately April, vaccination process will be open to the general public. It can be confusing because there are different rules in every single state, so which have been evolving over time. Compounding this is different federal guidelines, so and these will likely change over time. So you can pay attention to meetings such as this, websites such as mass.gov, and keep in contact with your own doctors to make sure that you know when to get your vaccines.
El Estado tiene su propia fórmula para la lista de las personas y cómo van a estar vacunadas. Si tiene cualquier duda o pregunta sobre cuándo usted puede vacunarse, puede preguntarle a sus doctores o chequear la página de mass.gov para más información sobre las etapas y cuándo vienen las vacunas para cada grupo de personas. Aproximadamente las etapas proceden de cada ciertos meses y la etapa 2 aproximadamente va a empezar el mes que viene. Todos los estados son diferentes y es importante conseguir información en eventos como estos, como el Facebook Live que estamos ahora, o en la página más.gov o preguntándole a sus doctores médicos.
Okay, thank you. That's all I have for today. If there are questions, perhaps they could be posted through the Facebook forum and passed on to us, and we can possibly answer them in future forums. Thank you very much.
Eso es todo para hoy. Las informaciones para hoy. Si tienen preguntas, pueden ponerlas a través del Facebook Live y el Departamento de Policía le dará las preguntas al hospital para que ellos las contestan. Muchas gracias y que estén seguros.
So our next Emergency Operations Center meeting is going to be on Monday, January 25th at 10 a.m. We'll always meet more frequently as the need arises. And we'll keep you posted with information on Facebook Live events coming on an as-needed basis.
La próxima reunión del EOC será el lunes 25 de enero a las 10 a.m.
Then I just again want to thank Dr. Powles for his time today, for sitting here with us for the Facebook Live, and Mr. Lemieux, Town Council Chairman Jack Chauvin, who's in the background, Town Councilor Adams, of course, and Jasmine. Last but not least, thank you very much.
Le queremos dar las gracias al Dr. Powers por estar con nosotros, al señor Lemieux, al presidente del concejal Jack Chauvin y concejal Dave Adams y al jefe Woodson, a todos ustedes, gracias por estar con nosotros. Buenas tardes.
Red bar, I think.
What's the one?